We struggled with her weight since she was like 10, 11. I would get on a diet. I would get her on a diet. I would lose weight and she wouldn't. So it was always a struggle for her.
I just couldn't lose weight.
She was kind of running herself ragged trying to lose this weight and not being able to do it, when the problems that she was having and the reason she couldn't lose the weight were hormonal. Obesity is a disease. It's been classified as a disease by the CDC and the NIH. And so there shouldn't be this shame around seeking treatment for a disease.
My doctor said she noticed that I was struggling to lose weight, and she recommended this place to me. It's the Cook Children Bariatric Program.
The program is a 6-month minimum program where we meet with our families every month to help them reach a common goal. Most families that have been referred here are referred here due to a primary diagnosis of obesity. They have definitely tried other things prior to enrolling in a medical weight loss program. We are pediatric specialists, so you're going to meet with pediatricians that specialize in obesity, our pediatric surgeon, you'll meet with our registered dietitian, we have psychologists available.
My mom has diabetes. So I'm like, I just don't want her to go through that process and get diabetes in the future. So I'm like, I'm doing it for her health. It was an easy peasy decision for our family. It was really not that hard. Once everything got cleared, we were like, let's go for it.
They said I was going to go through a 6-month program, and then after that, if I followed like all the rules, they would clear me to get surgery.
Aileen is somebody, when they talk about, oh, you have to work out, you have to exercise, she was already doing all those things. She was on a dance team. She was dancing at least an hour every day. I mean, so that was not an issue. But she did have common comorbidities that kids that are at this weight have, which make it difficult for them to lose weight. And so she came seeking our services. She was a perfect candidate. By perfect, I meant that she showed up to her clinic appointments. She kept her food journal. If anything that we asked her that needed to be done, she did them. When she needed to get her labs done, she got her labs done. So anybody can be a perfect patient, but she started off that way.
Aileen is an A+ student. She's an overachiever. She was consuming a little more than what she was supposed to of sweetened beverages, for example. So with her, we started from, all right, let's get the sweetened beverages out of our way. And that was our beginning. We're making very gradual changes to their nutrition and lifestyle before surgery so that it will be easier for them to continue after.
I complete a psychological evaluation to check on their appropriateness for the bariatric surgery. We're going to do whatever we can to help them, but they have to help themselves. And making sure that, okay, I go to my appointments, I show up, I'm doing what I'm asked to do. When the dietitian says, hey, stop drinking soda and drink more water, that you're doing that, because that's all getting you to that point of surgery and post-surgery.
The procedure that we do is a gastric sleeve. It is unique because of the recovery time is very minimal. It's basically a sleepover in the hospital. Our patients are so well prepared. They come in the morning of, they have the surgery, they're usually hanging out in their room after lunch, and by the next day, they are walking and moving, and we're often sending them home the next day.
I just felt really excited about this procedure. I was never nervous.
It was easy peasy. She went home. She was kind of knocked out from anesthesia for a while, but I mean, she was up and going, and after that, no pain, no anything, you know.
The comorbidities that she had before she had the surgery are now all resolved at 9 months.
I feel so much healthier. I'm in dance, and I feel like dancing now is a lot easier, and I just feel so much more confident with myself.
The sky's the limit for Aileen. She's very highly motivated. They are a complete success story.